Do you remember the last time you woke up feeling like a real man? Not just awake, but alive, confident, with a body that responded exactly the way it used to. If that feeling has faded, you're not alone. Every week, I meet men who quietly ask, "Why can't I get hard like before? Is it stress? Is it age? Is it just me?" I'm Dr. Henry Dalton, and let me tell you the truth. Erections are not just about desire or emotion. They are about blood flow. Without strong circulation, even the deepest love or highest libido can fall short. An erection is a vascular event. It depends on how well your arteries deliver oxygen-rich blood to a very specific network. From your abdominal aorta to the internal iliac artery, then the pudendal artery, and finally, the cavernous arteries inside your penis. If that highway is blocked, narrowed, or weak, performance suffers. And it doesn't matter how much you want it. But the good news, blood flow can be trained, improved, even restored naturally. In this video, I'll reveal 3 powerful methods that help men reclaim their erections without pills. One of them, the third one, is something 95% of men have never even heard of, but has been quietly used by doctors and physical therapists to transform sexual function at its root. So don't go anywhere. What I'm about to show you may change everything. Let's begin with one of the most overlooked, yet most powerful tools for restoring erectile strength. Kegel exercises, or more accurately, pelvic floor training. You might associate Kegels with women and bladder control. But the truth is, these muscles are just as critical for men's sexual health, especially if you're over 50. Why? Because the pelvic floor muscles wrap around and support the base of your penis. They're directly involved in both erection and ejaculation. When they weaken, so does your control. So does your firmness. And you might start noticing more partial erections or trouble finishing. Here's the good news: you can retrain these muscles. To find them, try this simple test. Next time you urinate, attempt to stop the flow midway. The muscles that tense up those are your pelvic floor muscles. Now imagine training those same muscles the way you'd train your biceps or legs. That's the principle behind Kegels. Start simple, contract the pelvic floor muscles. Hold for 5 seconds. Then release. That's 1 rep. Aim for 10 reps, 2 or 3 times a day. If you're consistent, most men begin noticing improvements after 4-6 weeks. Stronger erections, better control, a sense of strength returning where it had slowly faded. One of my patients, Richard, a 60-year-old retired school principal, had stopped dating because he felt embarrassed by his performance. I suggested pelvic floor training. He was skeptical, but committed. After 1 month of consistent practice, he sent me a message, "I'm back. Not perfect, but I feel like myself again." That's the kind of transformation we're talking about. Kegels are subtle but powerful. They don't just train your body, they rebuild confidence. But let's say you want something stronger, something that can generate an erection even when arousal is weak. You need more than just muscle work. You need to restore blood flow quickly and effectively. And that's where the next solution comes in. If Kegel exercises help build the foundation, then vacuum therapy, also known as penile pump therapy, is the tool that gets results immediately. This method works by using negative pressure to draw blood directly into the penis. The device, typically a transparent plastic cylinder, is placed over the penis. Once sealed, the air is gradually pumped out either manually or with an automatic mechanism, creating a vacuum that forces blood to enter the erectile chambers. In a matter of minutes, this induces an erection. No need for stimulation. No need for arousal. Just pure physics. Vacuum therapy is especially helpful for men struggling with erectile dysfunction, particularly after prostate surgery or in cases where nerve sensitivity has declined. I've worked with many patients who had given up on natural erections entirely until they tried this. Take Robert, a 67-year-old prostate cancer survivor. He hadn't had a full erection in nearly 3 years. We introduced vacuum therapy as part of his rehab. Within 2 weeks, not only was he achieving erections again, but his confidence and his relationship started to rebuild. However, this method isn't without its warnings. If used improperly, vacuum therapy can cause bruising, pain, or even tissue damage. One major risk is ischemia-reduced blood supply caused by excessive or prolonged pressure. That's why it's essential to use the device under professional guidance at first. A trained pelvic floor therapist or urologist can help you choose the right size, pressure level, and duration, typically 10-15 minutes, 2 to 3 times per week. Some men also use a constriction ring to maintain the erection after removing the pump. This can be helpful in certain cases, but again, use it safely and temporarily to avoid complications. To enhance results, vacuum therapy is often combined with vasodilator medications like tadalafil. Together, they improve both the immediate erection response and the long-term vascular rehabilitation of the penis. This is not just about performance. It's about reclaiming a part of yourself you thought was gone. And if you're now wondering, is there a method that goes beyond pumping? Something that doesn't just induce an erection, but helps your body naturally grow, lengthen, and regenerate function over time? Then what I'm about to show you next may surprise you. If vacuum therapy is about immediate blood flow, then the penile extender is about long-term vascular transformation and tissue adaptation. This device works through a principle known as mechanotransduction, a fancy word for a natural biological response to gentle, sustained stretching. By applying consistent tension to the penis over time, the extender encourages micro-tears in tissue, which then heal by generating new cells, new blood vessels, and greater length. Think of it like muscle hypertrophy, only targeted at one specific area. Unlike pumps, extenders don't rely on vacuum pressure or drugs. They rely on biology's own blueprint: stretch, recover, grow. When used correctly, a penile extender improves erectile function, increases baseline flaccid length, and in many cases, leads to noticeable gains in erect length as well. More importantly, it helps restore confidence because the change happens gradually, naturally, and without dependency on any pills or stimulation. But there's a process. Start with 30 to 60 minutes per day, and over the course of a few weeks, work up to 1-2 hours daily. The full protocol typically runs 3 to 6 months. What matters most is consistency and choosing the right device for your size. Many extenders sold online are generic or poorly built, with uncomfortable straps or uneven tension. If possible, consult a urologist or physiotherapist to ensure a proper fit and gradual tension increase to avoid injury. One of my patients, Luis, age 64, was skeptical at first, but after 6 months of disciplined use, not only had he gained nearly an inch in length, he also reported firmer, fuller erections and a renewed sense of masculinity that he hadn't felt in decades. It didn't happen overnight, but it did happen. Still, whether it's Kegels, vacuum pumps, or extenders, they all rely on one thing: blood. And to truly understand how to redirect blood where it's needed most, you must understand this simple but powerful truth: where it comes from and how to guide it. Whether you're strengthening your pelvic floor, using a vacuum device, or extending the penile tissue through traction, none of it works if blood doesn't get where it needs to go. Erection is, at its core, a vascular event. That's why understanding how blood reaches the penis is essential to reclaiming natural function. It all begins with the abdominal aorta, the main highway of your circulatory system. From there, a branch called the internal iliac artery sends blood into your pelvis. This artery then gives rise to the internal pudendal artery, the crucial vessel responsible for supplying blood to the penis. The pudendal artery further branches into the cavernous arteries and the dorsal artery of the penis, which deliver oxygen-rich blood directly to the erectile tissues. Now, picture this flow like a city's highway system. The abdominal aorta is the main freeway. The internal iliac is your exit ramp, and the pudendal and cavernous arteries are your local roads. Your penis, that's the final destination. But what happens if there's congestion plaques, weak arterial tone, or underactive musculature, just like a traffic jam? No matter how eager you are to arrive, you simply won't get there. This is exactly what happens with vascular-related erectile dysfunction. That's why the exercises and devices discussed earlier aren't just gimmicks. They're strategies designed to improve blood delivery. Kegels train the pelvic muscles to support blood flow. Vacuum therapy forces circulation temporarily, while penile extenders enhance vascular elasticity over time. Together, they reopen the roads, making sure blood travels efficiently to its intended target. But here's the catch. These methods aren't meant to be used in isolation. Just like highways, arterial systems work best when traffic is coordinated. Each part of your sexual rehabilitation should complement the others, not compete. So the real question becomes, how do you connect these tools into a unified system that works for your body, your age, and your goals? So now that you get how blood flow works, and why each method supports it differently, the next step is making them work together. Because here's the truth, most men don't fail because the technique is wrong. They fail because they stop, or they do one thing once and never build a rhythm. But like any training program, real transformation comes when you create a system and stick with it. So let me make it simple. On odd-numbered days like Monday, Wednesday, Friday, you use the extender. Just 1 to 2 hours. Low pressure, gradually build up. On even days like Tuesday, Thursday, Saturday, use the vacuum pump. 10, maybe 15 minutes. Follow the instructions. And every single day without fail, you do your Kegels. 3 sets, 10 reps, 5 seconds each. That's how you build circulation from the inside out. It's not about doing everything perfectly. It's about being consistent, giving your body the chance to recover, respond, and grow. And if you can, talk to a specialist, someone who can tailor this plan to your needs. Because the more personalized it is, the better your results will be. But maybe you're thinking, okay, I get it, but is there something even simpler? Something I can do tonight without tools, without effort, just a tiny action that actually works? Well, there is. In fact, what I'll share next takes just 7 seconds. But it's helped thousands of men feel like themselves, again strong, confident, and ready. And I'll show you exactly how to do it right now. So let's bring it all together. You've just learned the 3 most effective, science-backed methods to restore sexual function naturally. Kegel exercises to rebuild control and internal strength. Vacuum therapy to reactivate blood flow and oxygen. And the penile extender to enhance size, circulation, and lasting firmness. You've also discovered the real root behind all of it, blood flow. Without it, no technique works. But when it's restored, everything changes. And now, you even know how to combine these tools into a weekly system, something you can start tonight, at home, for free. No pills, no injections, no surgery. Just simple, honest training done consistently with the right knowledge. And if you're ready to take it one step further, don't miss what's coming next. I'm about to show you a natural 7-second method that's already helped over 60,000 men rebuild their sexual power without medications. Just a daily ritual you can do in your own bedroom. So before you go, like this video to help it reach others who need it. Share it with a friend or loved one. Comment below with your questions. I do read them. And most importantly, subscribe to the channel so you never miss new insights made specifically for men over 50. Save this video. Rewatch it if needed, because these simple shifts can protect your dignity, confidence, and performance.